Good evening and welcome, guys, to another Tuesday weekly wellness workshop. As always, I am Dr. Ryan Hyde. My wife, Dr. Haley, and we are the owners and chiropractors over at Glacier Family Chiropractic and Wellness. I know last week, Dr. Haley gave us an amazing class just showing us yoga and how much that can help relieve some of the pain and symptoms that we're experiencing in our day-to-day basis. Phenomenal class. I highly recommend after this class, maybe going back and revisiting her yoga class, because a lot of those exercises and poses that she had given us are actually going to be very beneficial, helping us with our topic tonight, which is low back pain. And low back pain for a chiropractor, it's always, you think of a chiropractor, you think low back pain. They tend to go hand in hand, and it is remarkable to me as a chiropractor how oftentimes people don't realize that we can adjust the other areas of the spine. We can adjust extremities, the shoulders, elbows, wrists, knees, ankles, ears. We can do it all. And it really just comes down to people just aren't educated. People just don't know that chiropractic can do so much more than just help with your low back pain, right? But tonight is all about the low back pain, exactly what it is, what it entails. There's a lot of misconceptions around lower back pain. So we're going to get into some of those. We are going to be giving some stats tonight, some pretty alarming and shocking research and statistics about low back pain. And then, of course, I don't want to leave you guys without some type of regimen, some stretches, some exercises, some lifestyle changes that are going to help you get rid of that lower back pain. Okay, so I was going through the World Health Organization's website, just because the World Health Organization, it tends to be something that obviously everyone throughout the world uses. And I found quite a compelling statistic here that is worrisome, especially as a chiropractor. So the World Health Organization says that in 2020, so mind you, that was 4 years ago, okay? 4 years ago, 619 million people with low back pain. 619 million, okay? That's over half a billion people on this planet suffer from low back pain. Whether it's, specific or non-specific low back pain, we'll kind of get into that in a little bit here. Regardless, 619 million people globally are experiencing low back pain. Right off the rip, that's something that drives me bonkers. There's no way people should be dealing with that. That many people should be dealing with that. Breaks my heart. Another kind of shocking factor is in 2050, so we're almost in 25 years, right? That number's supposed to go up by more than 200 million. Hey, Cass, how you doing, girl? Thanks for joining in. They're projected that by 2050, 843 million people will now have low back pain. Well, why is it going up so much? There's so many people trying to get out there and promote this stuff. Again, it falls to the education, guys. People don't know what they don't know. People think, oh, I just got that normal low back pain. It's not normal to experience pain throughout your body, regardless of where it is. The reason that happens is because your body is desperately trying to tell you, hey, there is a bigger functional issue going on here that we need to address. Our body addresses it by sending those pain signals to our brain, letting us know, hey, man, that right hip it hurts. Yeah, probably because there's some kind of dysfunction or dis-ease going on in that area. It's your body's way of telling you, hey, we need to get this looked at. Another statistic here too that is just so disheartening. Low back pain is the single leading cause of disability worldwide. Period, hands down, low back pain is the leading cause of disability worldwide. Again, people, we're not talking about the US. That's a lot smaller population. We're talking globally. And it's the leading cause. But yet people don't know what to do, or may not even want to at that point. They may think, oh, it's just an ache or a pain. It's not going to lead to anything crazier. Sorely mistaken there. Um, Another big statistic that I took from the WHO, and this is where it really kind of hits home, okay? $635 billion annually. Every year, $635 billion is spent on low back pains in the U.S. economy. So whether that's, surgeries, over-the-counter medicines, prescription opioids, physical therapy, chiropractic, all of this is going at $635 billion is what's going to the cost of low back pain in the U.S. economy. That is an unfathomable amount of money. And honestly, guys, it's not hard to correct. You got to be willing to make a change. You got to be willing to stay consistent and make a commitment for your health. Again, I can't remember if I told the story with you guys a couple weeks ago or if it was at one of our other presentations. But a favorite Chinese proverb of mine is about the bamboo tree, right? And it goes on to say that a bamboo plant, when you first plant it, it needs to be watered and fertilized every single day. Otherwise, it's going to die, right? You have to do that for 5 years, okay? 5 years, every single day. Water, fertilize, water, fertilize. And for 5 years, you see nothing. You see no growth. Nothing sprouts from the ground. Nothing, right? But after that 5 years, you hit that 5-year marker. In 9 weeks, that plant grows 90 feet. And that's kind of like chiropractic care. It takes time. We have to get the body back to where it truly needs to be. These things do not happen overnight. It's not a one crack fixes all type of thing. It takes dedication. It takes commitment. It takes lifestyle changes. But if you want to begin to express a fuller, happier, healthier lifestyle, it's one of those things you have to commit to. Dr. Haley and I always use the analogy of people are so good about brushing their teeth morning and night, right? They may never have had a cavity in their life, but they brush morning and night. Why is that? They're trying to prevent the cavities, right? Your spine controls your entire body, and people never get checked. Never. It's one of those things where if we can bring awareness to the situation, it helps with everything, right? So keep in mind those kind of statistics as we go through the talk here tonight. So I had mentioned earlier, I had said something about specific low back pain and non-specific low back pain, okay? Specific low back pain is something that's diagnosable, okay? So for instance, degenerative disc disease, an arthritis, a disc bulge or herniation, a scoliosis in that lumbar, maybe somewhere in their lumbar spine, their bones fused. Maybe they have a structural abnormality, okay? So those specific low back pain has a direct, relatable diagnosis with it, okay? Now, you might be surprised to hear those are the outliers, okay? That's the 10% right there, the specific low back pain. So all those, and there's more that are included within that specific. I just listed off a few examples of diagnoses that would fall under that specific low back pain. And again, that is the 10%, okay? The World Health Organization also tells us 90% of cases of low back pain are due to non-specific low back pain. And the WHO, World Health Organization, defines non-specific as meaning when it isn't possible to identify specific disease or structural reason for the pain. So to sum that up, someone has just general pain in that lower back area and they don't know what it's from. It's not from degenerative disc disease. It's not from arthritis. It's not from a scoliosis. It's not from a specific diagnosis. It's just, I don't know. And that's where you'll hear people say that, oh, it's just that normal low back pain. Ugh! No, it's not. It is not normal to have that kind of pain, okay? So when we're talking about the lower back pain, predominantly we're talking about this non-specific low back pain, okay? And in all reality, the non-specific low back pain tends to honestly be one of the easier ones to deal with because it comes from more of a postural aspect. Maybe we're doing something in our day that our job requires to do things over and over and over and over the same way, day after day after day. After a while, that's going to wear down on your body. It's just like any type of machine. You keep doing it over and over. It's got to get some maintenance at some time, right? Your body is no different. Okay. So with this non-specific low back pain, that's why you hear Dr. Haley and I talking a lot about yoga, stretches, exercises, lifestyle changes, diet, maintaining good posture, taking posture breaks throughout your day. If you have a desk job or, you're constantly sitting down, leaning over, the non-specific does great with adjustments, right? Postural exercises works phenomenally with them. But you shouldn't just take my word for it, right? So what I did here for us is I got a couple research papers, okay? I know I said today was going to be a little research dominant, okay? And this is all from PubMed. You can go right to just www.pubmed.com, and you'll be able to pull up all these similar research articles. Now, one I want to start with right here, and I'm going to break this down because the title sounds like a lot and it sounds overwhelming. Spinal high velocity, low amplitude manipulation in acute non-specific low back pain. A double-blinded randomized control trial in comparison with diclofenac and placebo. The heck does that mean, Dr. Ryan? All right. Basically what they did is they took who gets better. Is it people that get adjustments, people that are taking meds, or the placebo effect where they think they're getting something, but they're not? So it's kind of that like mental aspect of it, right? So the paper goes on to say their objective is to try to find the effectiveness of spinal adjustments compared with the non-steroidal anti-inflammatory drug, diclofenac, and then a placebo, okay? So what they did was they randomized 3 different groups. One group got spinal manipulation or the spinal adjustment, and then a placebo of the anti-inflammatory drug. So they thought they were taking the drug, but it wasn't the real drug. It was just like a sugar pill. That's what like a placebo is. So the first group was getting chiropractic adjustments and getting a placebo, okay? The second group was getting a fake chiropractic adjustment and the anti-inflammatory drug. So they were getting the real drug, but not the real chiropractic adjustment. And then the third group was a fake chiropractic adjustment and the placebo of that anti-inflammatory drug, okay? And when we get down to the results, first thing that pops up, the adjustment group was significantly higher than the anti-inflammatory drug group. Now, no adverse effects or harm were registered in any of the 3 groups. So again, that goes to show you that there's no adverse or harm to getting those chiropractic adjustments, okay? Now, the conclusion of this study was in a subgroup of patients with acute non-specific low back pain. So that, again, that's that general low back pain. They don't know what it's from. There's no real diagnosis. They just got that general low back pain. So with that general low back pain, spinal adjustments were significantly better than the non-steroidal anti-inflammatory drug. So basically what that means is patients are getting significantly better when getting adjusted consistently. If you guys were all there for my consistency talk, this is why it is so important, because you can't just get that adjustment once and then be okay with everything. You got to continue that. You got to stay consistent with it. But significantly better than the anti-inflammatory drug itself, right? So don't just believe that one. Let's check another one, right? Now this next one, excuse me, is titled Impact of Chiropractic Care on Use of Prescription Opioids in Patients, okay? So the goal of this one, or the objective of the finding, was Our objective was to evaluate the impact of chiropractic utilization upon the prescription opioids amongst patients with spinal pain. So basically getting into who's using them compared to the adjustments, okay? So what they did is they got two different groups again, okay? One group received both primary care, so like a general practitioner, your regular MD doctor, and chiropractic care. And then the non-recipients received primary care, so just their medical doctor with no chiropractic care, okay? What they saw, patients with spinal pain who saw a chiropractor had half the risk of filling an opioid prescription. I'm going to stop it right there, right? Patients with spinal pain who saw a chiropractor had half the risk of filling an opioid prescription. Now, I know most of you are very weary of the opioid pandemic that's going on in this country and throughout the world. Our goal as chiropractors is to, again, we want to address the cause of what's going on. Now, I'm not saying medicine in modern day medicine doesn't have its place. It does. I always use the example. If someone came into my office with a bullet wound, I'm not going to tell them to get on the table and adjust their C1. No, get to the hospital. You need medical intervention. The problem with today's medical intervention is it goes straight to minimizing the symptoms, right? It never addresses the cause of what is giving you those symptoms. It just masks the symptoms. So if you're having that lower back pain or you're having pain in that low back area and you're just taking these opioids, well, yeah, you're out of pain, but what have you done to correct the problem in the first place? You're just slapping a Band-Aid over a huge problem that's only going to result to you continuing to take opioids, continuing to take these over-the-counter medications, and then you start building up a tolerance. So you got to take a little bit more. Then you got to take a little bit more. Then you got to take a little bit more. And next thing you know, you're at a place that you never thought you would be. So again, patients with spinal pain who saw a chiropractor had half the risks of ever even going and filling a prescription, right? So one, they're saving money right there, saving money on the prescription. Now, among those who saw a chiropractor within 30 days, the reduction in risk was even greater as compared to those with their first visit. So meaning those people that continued, stayed consistent, and kept coming to the adjustments, they stayed good with the chiropractor. They saw an even higher rate of improvement and a less chance of heading to the pharmacy to fill their prescription, right? And again, people, these are just two small articles, okay? I know the research can be kind of daunting sometimes, and it gets a lot, but the proof is out there, right? Why not try the least invasive method of something first? Chiropractic is that least invasive method, okay? We talk about stretches, exercises, staying consistent and frequent with your adjustments. You know, people will sometimes, whoa. I got to come 3 times a week, 4 times a week for 3 months. That's a lot of time. Yeah, you're right. How many years have you been with that low back pain? Right? It's not realistic for me to fix something in 2 to 3 adjustments when you've been dealing with something like that for years. Not to mention, guys, we're dealing with osseous bone, right? That stuff is hard. It doesn't move very quickly. It takes time and repetition, consistency, frequency, education in order to get you to the point that you want to be at as far as with that low back pain, right? So how do we do that? You know, I've been sitting up here running my suck about what specific and non-specific low back pain is, throwing a bunch of research and numbers at you guys. But what are you supposed to do about it, right? Well, here we are. So I actually had a buddy of mine hit me up a couple weeks ago, and actually, Joe Barry is in the party here. So my buddy Joe and I, we were roommates in the Marine Corps. He called me up a couple weeks ago, said his buddy was having some severe low back spasming and stuff like that. And I gave him six minor, easy stretches and exercises to help with that area. Now, when you guys are going through these exercises or poses or stretches, I have them in order going from least invasive to getting more and more advanced, right? Not only are we starting from a minimal point and working our way up, right? We don't want to just jump right into one of the more aggressive ones, right? We want to acclimate our body and start getting used to these processes and stuff like that. But it's also very important to address the fact that, yes, I understand you're experiencing some low back pain, 100%. We're going to address that. In order to address that and make it easier on everybody, we should try to make sure that the area above it's pretty relaxed and the area below it's also pretty relaxed, right? If we can get those two areas above and below to kind of relax and mellow out, it's only going to make that lower back area that much easier to help correct, relax, loosen up, whatever it may be, right? So I am going to preface this. This is a little bit of a challenge for you guys. I want you guys to go out there and actually look up these stretches, right? So when I go through them, have a pen and paper, write these down. I'll repeat them a couple times. But I feel that it's very, very important to, if I just get up here and I blabber on and I tell you how to do everything, you kind of retain it, you're listening, you kind of get it, right? It works so much better if, one, you listen to it. So I give you the stretch or the pose or whatever, but then you go do the work and figure out how to, okay, go onto YouTube. All right. So Dr. Ryan said, supine lumbar flexion. All right. I'm going to type that one in and look at a couple different ones. See which one resonates best with you. They're all going to be relatively the same. There's not many variations of these stretches or poses, but find the one that resonates best with you. Now, not only did you get me explaining or telling you what to do, but now you're adding in the extra learning experience of doing some of the research by yourself. What that does is help solidify different connections in your brain to allow you to remember these certain things and hopefully be able to teach somebody else that you know. I mean, I feel like we all know somebody that is dealing with some type of lower back pain. All these stretches and poses that I'm going to be giving you right here can all help them, right? So, hope everybody has their pen and paper. I'll go through these slowly and then I'll repeat them again, okay? So the first one I'd like you guys to start with is called supine lumbar flexion, okay? Supine lumbar flexion. Now the next two are going to be yoga poses. The first one is going to be called happy baby. I got to tell you, some of these yoga poses are just, I love their names. They're absolutely hysterical. So we had happy baby pose. The next one is going to be child's pose. It's a fairly popular one. And then we start getting into a little bit further stretches. You're going to be able to work things a little bit more. The next one is going to be called thread the needle. And again, like we just talked about, thread the needle, yeah, it's going to help with the lower back pain, but it's going to help loosen up that area right above it, which is so vitally important to helping loosen up that lower lumbar area. So thread the needle. Number 5 is going to be supine pigeon pose. Okay, so supine pigeon pose. And then the last one is simply called bird dogs. So I'll run that list through you guys again. Number 1, supine lumbar flexion. Number 2 is happy baby pose. Number 3 is child's pose. Number 4, threading the needle. Number 5, supine pigeon pose. And then the last one is bird dogs. So again, guys, I challenge you to take those, go to YouTube tonight, look those up, see which ones you tend to resonate best with, and use those in progression to help with that lower lumbar spine, that lower back pain that everybody seems to be experiencing, right? And I also always want to leave you guys with this. Dr. Haley and I are here for you. We have a very big saying in our office. We want nothing from you, but we want everything for you. You deserve to live the best possible life you can. And that means being healthy and happy. So by all means, if you have any questions, Dr. Haley and I, we're nerds. We love talking about this stuff. If you're not sure if you want to set up an appointment, if you just have some questions, give us a call. We offer free screenings. You call, We get you scheduled for a 20, 30-minute just consultation. Sit down. Ask us questions. It's very low pressure. We're not going to force you or pressure you into, oh, we got to get them signed up right now. We got to get them in the... No, because for us, it's about the education. When you feel that you are ready to make a life change, you'll come to us. You'll be ready for it. Or you'll go see another chiropractor. Or you will make the change when you feel it's right. We just want to be the ones to offer the education to you at no cost, a very low pressure environment. You get to come in, you get to meet me and Dr. Haley a little bit, kind of feel us out, see the office. And again, very, very low pressure, guys. We just want to do the best we can to educate our community and keep them as happy and healthy as we can. I'm a true believer in the more people that are healthier and happier, you're living a better life, right? And the ones around you, it's hard to be upset and sad when so many people around you are happy. If we can change this world and make it a healthier, happier place, it's going to be better for all of us, guys. All right. So I'm going to leave you with that. Thank you all for joining tonight. We really appreciate it. We love doing these. Next week, Dr. Haley will be going over the 3 P's of prenatal chiropractic. Yes, you guys can get babies adjusted. Babies can be adjusted. I won't steal too much of her shine for next week, but I hope you all can join us then. We look forward to seeing you next week with Dr. Haley. Have a good night, y'all.